Doc Talk with Dr. Paul Conley is copyright 2021, Signer Foundation, and is solely responsible for the content.
Hello, I'm Dr. Paul Conley, and thank you for tuning in to another episode of Doc Talk. What a beautiful day that we have here today in West Virginia. And one of the reasons why we wanted to bring this special Doc Talk out to you folks is because I'm here with our guest, Dr. Anita Stewart, here at our local Fayette County Public Health Department. We're here on site. And if you notice, one of the things that we are not wearing are these masks, okay? We are maskless here today on this episode. And the reason why is because we have got some new information that you're going to want to watch and listen to, that the CDC just changed some of the guidance out there. And Dr. Stewart's here today to walk us through this new guidance. So what a great day.
Yeah, thanks for having me. It's a beautiful day. We're outside enjoying the sunshine and breathing the fresh air without a mask.
I know now I can actually hold this in my hand, because all of our other episodes, we've worn masks because that's what we've been trying to do. And you here, our local health department here in Fayette County have done such a tremendous job with everything that you have done here locally, and all the meetings you've been attending and everything. And we're actually now, I feel like we're on a dawn of a new day with this pandemic. Finally we're seeing numbers starting to decrease. We're seeing hospitalizations and deaths declining, and you can't say enough about vaccinations. So tell us a little bit. The CDC just came out, since our last show, some things have changed. The CDC has changed some of their guidance and recommendations for fully vaccinated people. So maybe you can tell us a little bit about this new recommendation.
Yeah, so there's three main points for these recommendations. There are three main scientific reasons. So it's important as scientists that we're evolving with the evidence. And so what we have found is that, number one, in real life experience with the vaccinations, that these are 90% effective at preventing the COVID-19 infection. Number two, they seem to be very effective against the variants that we're seeing across the country. And number three, it appears that the vaccine reduces transmission. So if you're vaccinated, you're less likely to spread the virus if you would have the virus. So those are all three things that make us very happy and reassured about the safety of the vaccine and us moving forward with lifting some of these restrictions and getting back to life as we know it.
So, we talk about, I think, how we as physicians, we're always looking at the numbers. And so maybe, we've talked about, back when you gave me my vaccines, okay, back in the middle of December and the 1st of January, that was a really dark time, in this country. That's when we had such a huge spike. We had this big surge. So kind of maybe you can tell me where we were then and where we are now, as far as like what are you seeing here in West Virginia and here in Fayette County as far as numbers that you've been seeing as far as case numbers?
Yeah, so just like you said, we did have that big spike kind of at the end of the winter, or beginning of January, that time. And just in the last probably 2 to 3 weeks, we've seen a pretty rapid decline in caseload. And so what that means is the incidence or the daily new cases that we're seeing have decreased. We previously were seeing 100 to 120 cases a week, and now we're seeing anywhere from 60 to 80 cases a week. So I'm really thrilled with that. It still needs to be lower, but we're moving in the right direction, certainly.
So, we talk about cases. One thing is, as well, we look at serious illness, hospitalizations, and deaths. So, kind of where are we with that as far as deaths, and are we seeing a downward trend with that? I would think if cases go down, obviously you would think hospitalizations and deaths. Kind of where are we at with that?
Yeah, those numbers are decreasing as well. Across the state, we're seeing decreased numbers of hospitalizations, ICU admissions, ventilator need, as well as a decrease in death across both our county and the state.
So, when we talk about fully vaccinated individuals, I guess maybe just so people watching the show, what exactly does fully vaccinated mean? I know we got several vaccines available. We have Pfizer, which is what we received. You have Moderna, and you have Johnson & Johnson, and I know all those are available here. And I know I had some folks even today come out and visit you today that got vaccinated today, and some of those were teenage girls. So again, it's so important that and we're going to talk about just in a second how teenagers are now eligible. So what exactly does it mean to be fully vaccinated? Is it 1 shot, 2 shots, after 2 shots? Tell me, what is fully vaccinated?
Yeah, so fully vaccinated by definition for the mRNA vaccine, so that's your Pfizer and your Moderna. Those are the 2-shot series, so it would be 2 weeks or 14 days after that second shot you would be considered fully vaccinated. For the single shot option, which is the Johnson & Johnson product, that would be 14 days after that single shot. So within 2 weeks of that injection, you would be considered fully vaccinated.
So, one of the questions, that comes up is, okay, if we're fully vaccinated, what does that mean as far as not wearing masks? Is that not being wearing masks around other vaccinated people? Can we not wear masks around unvaccinated people? Travel, how does that mean, like on airplanes, airlines, healthcare? Are there certain settings that we still, would want to wear a mask?
Yeah, that's a great question. And so what we know now is that in most scenarios, you can stop social distancing and you can remove your mask if you are fully vaccinated. But there are a few situations where we would want you to continue to wear a mask, where there could be a potential for higher spread. One of those would be public transportation. So, trains, planes, automobiles. If you're sharing with other people, we would want you to be masked under those scenarios. The second one is in healthcare. So if you're doing hospital, outpatient, any other type of health care, we would encourage you to be masked during that time. The third would be in congregate care settings, so homeless shelters, long-term care facilities, jails, any place where we know that spread can happen very quickly, we would want people, even if they're vaccinated, to continue to mask.
So I guess on the flip side, if you've not been vaccinated, like again we've talked about with these 3 different vaccines, what does the new guidance mean for them? Or is it still business as usual, wear your mask, social distance? So for the folks that still haven't been vaccinated, what does this mean for them?
Yes, so at this point we know that vaccines are safe and they're effective, and we encourage everyone to have one. So to keep our community safe, we're encouraging people to vaccinate. If you have not been vaccinated, we encourage you to continue to mask. At this point in time, we know that that's the safest option moving forward.
So again, it seems to me that one of the things the CDC, I think, has done here is actually, again, folks like yourself that have done all this hard work and have really pushed being vaccinated. I guess it gives us a little bit of a reward, okay? It's a sense of maybe a gold star or maybe a pass that since you've been vaccinated, you can actually take your mask off. But if you've not been vaccinated, you're still susceptible, right? You're still vulnerable. I mean, you still obviously can contract COVID. So, if you've not been vaccinated, things really haven't changed, for these individuals. And so again, how can you make that change? It's, get your vaccine. So I guess, there's been some discussion about safety that continues to be brought up to me quite often. J&J, issues with potential blood clots. I've heard issues about, fertility. Maybe you can kind of go back again, with the vaccines. I mean, now we're months into this. Maybe we can just talk a little bit about the safety and maybe touch on, some of these concerns that patients still or people still bring up about Johnson & Johnson, how, there was a pause, but now it's back, and maybe some of the other safety concerns that people may have.
Yeah. One thing I just want to say is that I think that it's important that we continue to monitor and evaluate the vaccinations, and that we look at what we call like real world data to see, number one, how they're working, number two, how safe they are. And so I think it's important to know that I think that we've done a great job with this. I think that the pause with Johnson & Johnson just shows that we are taking safety seriously within the FDA as well as with the CDC, and that it was made from out of caution. So I think that it's important not to repeat the myths, but certainly to get the education and get the information that is accurate. As far as the concerns with clotting, that's not really borne out with either of the mRNA vaccines. They did not see an increase with that. As far as the Johnson & Johnson vaccine, as we discussed in the last program, the central venous sinus thrombosis, there were 15 out of over 7 million doses given. So very, very low likelihood. It's still an excellent vaccine and poses, very minimal risk to getting the vaccine.
Right, so basically even with the J&J, the number that we're talking about is, you have a greater chance of being in a motor vehicle accident, driving to work than you do of one of these blood clots. And so I think people need to understand that it's extremely, extremely safe. And again, kudos, to our, Food and Drug Administration to really, again, be super, super safe. And I think, we're very fortunate that, the United States with the FDA, CDC, these basically organizations, that's what they do. And so that pause, again, was just take a step back, and especially to the fact that, like you said, the messenger RNA vaccines, which is our Pfizer and Moderna vaccines, there's not been any evidence whatsoever of any clotting disorders again. And again, you have basically the same chance of being struck by lightning as getting blood clots. So I've had some people talk about, infertility. Is there any evidence at all that these vaccines could cause any problems in a childbearing woman as far as sterilization or fertility at all, Dr. Stewart?
No, that has not been borne out in any of the research, nor has it been borne out in the real-life studies that we have from people that have been vaccinated. We have great evidence in pregnancy and in breastfeeding now that it is safe and effective. We're even seeing antibodies being passed. If we do cord blood studies, we're seeing antibodies being passed, antibodies through breast milk, which is excellent. That helps keep our newborn population safe and protected from the COVID-19 infection as well.
Yes, I think that's important, so not only there's not been any evidence, not a shred of evidence at all, that these vaccines cause any problems with your potential of becoming pregnant, but women that have had received the vaccine, when they have that child, the antibodies, the maternal fetal antibodies, are transmitted to that child, and so that woman's child actually has neutralizing antibodies against this novel coronavirus, which I think is exciting.
Yeah, it's what we call passive immunization, and I was thrilled to see that data come forward.
And I know that we don't really know how long the infant will maintain these antibodies, but I just I know time will tell. But again, I think that's such a good thing to know as a mother that not only did you receive the vaccine to protect you and your family and potentially other children that you have in the household, but now your new baby. And so, and speaking about children, we're coming up on a break, but there's some more exciting news when it comes to children, because when the vaccines first came out, the children were not actually part of the vaccine rollout, but that has changed as well. So we're going to come right back with Dr. Stewart. We're going to take a quick commercial break, and we're going to talk about childhood vaccination of COVID. So stay tuned, and we'll be right back. To Doc Talk. So we're out here with Dr. Anita Stewart, who is our local health officer here in Fayette County, and so we've been talking a little bit about the new CDC guidelines and some of the changes for fully vaccinated individuals. And we've talked about the fact that if you've been fully vaccinated, that you can actually go without a mask. Again, there's a few instances where you would still want to wear a mask. Again, if you're like on a plane, train, automobile, as you said, or in healthcare. And then there was one more group of individual that would still want to consider wearing a mask, and who would that be?
Yeah, so those would be your immunocompromised individuals. We would want them to make sure they continue to mask, as we know that they might not have a full, robust immune response like someone with a normal immune system.
Is, we talked about the children. We're talking about, passive immunization, maternal fetal antibodies. So one other exciting thing is the children. So now children are now eligible for vaccination. So maybe you can tell us a bit about who is eligible now.
Yeah, so we're very excited. The Pfizer product was approved and supported by the Advisory Committee on Immunization Practices and the CDC to open up vaccination for 12 to 15-year-olds. So we're having 12 to 15-year-olds step up to the plate and roll up their sleeves to get vaccinated to keep their communities safe and protected.
And you've been vaccinating those individuals, correct?
Yeah, it's been really exciting to watch the 12 to 15-year-olds step up. We have about 1,800 of those in Fayette County, and we've been having events here locally, and it's certainly renews my hope that we're going to get through this, because they come in with quite lots of confidence and determination to kind of get to life back as we once know it, and to be normal teenagers again. So really excited. They're leading the way. I'm very proud of this group.
And I think maybe part of it too is children are kind of used to being vaccinated. One thing I think that is good about the state of West Virginia, although there's many good things about the state of West Virginia, but one is that we do have a very strong and robust vaccination program when it comes to children and going to school. So I think about these children, 12. I'm thinking, well, they're still used to getting their child immunizations, and so I think maybe some of these folks are kind of like, or these children are like, hey, listen, you know what? I'm used to getting vaccinated. And so, I've talked to several kids, and in fact, I've talked to some that are under 12, and right now they're a little bit disappointed that they're at this point not eligible to receive the vaccine. So, any thoughts at all about children under the age of 12, when they may be eligible for vaccination?
So for the Pfizer products, the estimation is that we'll have enough data by September, so hopefully before the start of school. Moderna products are also considering applying for those amendments as well. So I think certainly by the end of the summer we'll know a little bit more, and hopefully we'll be able to get more age groups vaccinated and protected.
So, one thing is, we keep hearing about these, variants, and the variants that we keep hearing about. We've seen, the news about other countries, around the globe, and some of the issues that they're having. How are the vaccines? How do they stand up against these variants?
So right now we're testing about 10% of the positive sequences that we get, and the vaccines do appear to be working well against those specific strains. So we're feeling hopeful and confident in these vaccinations at this point in time. We will continue to monitor, though, that as we know that sometimes there can be a shift where it might not be as effective, and we might need to bring the masks back. But at this point in time, it does appear that the vaccines are quite effective and that we can move forward with these guidelines.
So that's amazing, that we, developed, this vaccine, for this one strain of coronavirus, but as these strains, have arisen, the vaccine is still showing some spillover into these, covering these other strains. We still have neutralizing antibodies that, protect us against these other strains. One of the questions that some patients have asked me is, what about my child who's under the age of 12? What does this mean for them? That they're not vaccinated, they're not eligible for a vaccine at this point. What does that mean for them that go to either daycare or go to summer school or what have you? Do they still need to wear a mask?
Yes, so we're recommending that all kids that are under the age of 12 that have the capacity to wear a mask safely to do so. So that would be a child that was able to remove their own mask, protect their own airway, those types of behaviors. The best way to protect your children that are unable to get vaccinated is to vaccinate your household. So for parents to get vaccinated, grandparents to get vaccinated, kind of create a bubble around those kids, and make sure that people are vaccinated at summer camps and that work at daycares, that work in places where kids go during the summer, and that we continue to mask in those environments until we can get those kids vaccinated.
So it's basically like herd immunity amongst your home. You know, we talk about this herd immunity, and I think there have been studies showing that children that live at home with parents that have both been vaccinated, there's very, very low risk of transmission. Is that right?
That's correct, and we know the flip side of that is if we have parents, and kids are more likely to be infected if you have parents at home that get infected. So the best way to protect your children is to get yourself vaccinated.
Yeah, and so, you know, again, if you have that child who's not eligible, who is under the age of 12, the best thing you can do to protect them would be, again, roll up your shirt sleeves and anyone 12 and older within the household, because again, that bubble that you talk about, that herd immunity, everyone in the house is vaccinated, which then therefore should be protective for that child who's not. What about masks in schools, teachers? What does this mean for them?
Yeah, at this point in time, we are recommending that schools continue to mask at this point. That could likely evolve depending on rates of vaccination and areas of the country, depending on incidents, things like that. But at this point, we're going to continue masking in schools.
So what about work? You know, do I still need to wear a mask if I go to work that's not a healthcare setting? What about you know, wearing a mask in other situations, ball games, ballparks, stadiums? What all does that mean for these folks?
Yes, so businesses and public place or private places rather have the authority to say, you know, we just don't quite feel comfortable with this. Our vaccination rates in our community aren't quite where they need to be. Or, for instance, like for Fayette County, we have a lot of tourism here. You know, we don't really know who's coming in that's unvaccinated. So some businesses are opting to maintain this mask policy a little longer, just to see kind of what happens. And until we can get the vaccination rates a little bit higher. And I think, you know, all of those answers are appropriate, and I encourage everyone to be respectful of those policies, with a common goal of keeping everyone safe, and particularly those that are not able to be vaccinated at this time.
So, you know, one of the questions, you know, people have asked me is, how do I know if someone has been vaccinated or not? I know, you know, we're really relying on the honor system here. How does one go about that? Because I'm sure some people are still a little bit concerned about the CDC's new recommendation. I mean, we've been, you know, mask, and now we're shifting gears just a little bit. What advice do you have in regards to that?
I mean, I think that's a personal decision of what risks are you willing to take. I don't think that we should go and judge and point fingers and ask people. I think that's a personal decision. What we know in the data is that, you know, really a lot of pushing, or a lot of what we call vaccine shaming, mask shaming, that doesn't work. That causes people to really dig in their heels, push back, to take the mask off, to be less safe, and to have higher risk behaviors that could spread virus. So really, just if you're not comfortable and you don't really know, keep your mask on. I think it's appropriate to do that, or make safer choices in the activities you do. You know, do things outside versus inside. The same stuff we've been talking about for the last 15 months. You know, continuing those behaviors to help keep yourself safe.
Yeah, and I know with us being outside, you know, I know that studies have really shown time and time again that transmission outdoors is extremely low. So I think, you know, if there is concern, you know, if you can have, you know, gatherings, you know, outdoors, we definitely, you know, really reduce your risk of spread.
Yeah.
And there's one other thing that has changed as well. You know, when the vaccine first came out, when we first did our first show on that, you know, we talked about something called co-administration of the vaccine, which maybe you can define again. What does co-administration of vaccines mean? and what has changed?
Yeah, so what co-administration means is when you go to your provider, your pharmacy, to the health department, and say you're due for a tetanus, shingles vaccine, and then maybe potentially get your COVID vaccine. Now the guidance has changed, so we found that it doesn't seem to matter if you do those at the same time. Our only request is that you would do it in a different site, so a different arm essentially. And so what we know is that those preventive vaccines like shingles, like tetanus, like pneumococcal, Menactra, those vaccines in both adolescents and adults are really, really important, and so we certainly don't want to delay those. And so those have been able to be given together now, and so you can go to your healthcare provider, get all of those services at once.
So that's amazing. So now we're opening up for teenagers. So if a teenager comes to you, the health department, and says, I want to receive the vaccine, you know, for cervical cancer, HPV, and I'm now eligible for COVID, that individual can get both those vaccines at the same time.
Absolutely.
So, I mean, this is all amazing, and I tell you what, I appreciate you again. We're coming up at the end of the show. You know, I could have you out here all day, and especially with the weather as nice as it is. But Dr. Stewart, I really appreciate everything you're doing here at the local level. You know, here at Fayette County, you have been so amazing with pushing the vaccine. And again, folks watching the show, the vaccine is available pretty much where?
Every day of the week at the Fayette County Health Department. All of our healthcare partners here in town have the vaccine. Pharmacies locally also have it.
So if you want to get a vaccine, it's there. So again, thanks for tuning in to this special episode. I'm here with Dr. Anita Stewart. I'm Dr. Paul Connolly. You've been watching Doc Talk. Until next time, have a good night.
Doc Talk with Dr. Paul Connolly is copyright 2021, Signer Foundation, and is solely responsible for the content.